So today we'll begin a simple primary care review on post-traumatic stress disorder. Post-traumatic stress disorder, also known as PTSD, is defined as intrusive thoughts, nightmares, or flashbacks of past traumatic events, avoidance of reminders of trauma, hypervigilance, and sleep disturbance, all of which will lead to considerable social, occupational, and interpersonal dysfunction. PTSD is commonly a chronic condition, with only one-third of patients recovering after a 1 year follow up, and one-third of patients are still symptomatic 10 years after the exposure to the trauma. Types of trauma. Sexual assault is the most frequent type of trauma experienced by women with PTSD. Mass conflict and displacement of the factors associated with PTSD include reported torture, cumulative exposure to potentially traumatic events, and the assessed level of political terror. Combat causes PTSD to occur after combat injury appears to be strongly correlated with the extent of injury and with the occurrence and severity of traumatic brain injury. Traumatic physical injury is associated with the onset of PTSD, which is the self perceived fear of death during a traumatic event. Clinical manifestations. All patients with PTSD have some element of the cardinal features, which include experience of the traumatic event. This also includes flashbacks, severe anxiety, dissociative episodes, fleeing, and combative behaviors. Traumatic events. This includes motor vehicle accidents, exposure to violence in military operations, home invasions or robberies, rape, or severe physical illness that threatens death. Individuals may be the victims in these events, but may also be observers of an event, or may hear about a loved one having experienced the event. Intrusion symptoms. Intrusion symptoms, also known as re experiencing symptoms, are the hallmark of PTSD. Unwanted, intrusive memories of the traumatic event vary widely from occasional unwanted thoughts about the trauma to frequent nightmares to flashbacks. Intrusion symptoms are typically associated with substantial psychological distress, such as fear or panic. Intrusion symptoms can occur spontaneously or be triggered by events that resemble or symbolize an aspect of the trauma. Avoidance symptoms. Patients may try to avoid internal thoughts or feelings related to the trauma, but it may also avoid activities, people, or situations that remind them of the trauma. This avoidance may lead to impairment in daily life functioning, for example, if it leads to avoidance of driving in a vehicle or being in a crowded location. Negative cognitions and mood. Patients may have decreased interest in activities such as work, leisure, or social engagements. Many patients experience excessive guilt about the event and blame themselves for the occurrence. This may lead to negative beliefs about themselves and may ultimately change their worldview. They may begin to see the world as a dangerous, malevolent place. Arousal and reactivity changes. Patients may initially present with symptoms of irritability or aggressive physical or verbal behaviors. Other symptoms may include reckless or self destructive behaviors, such as substance use, feeling on edge, being easily startled, decreased concentration, and sleep disturbances. Dissociative subtype. Depersonalization, which is the person feels disconnected from one's body. For example, they feel as if their body is not their own, or they feel lost or in a daze. Derealization. The definition would be the person feels as if the world around them is not real. For example, they feel as if they are watching the world or experiencing the world in a dreamlike state. Amnestic symptoms may also be present in PTSD. This may include an inability to remember aspects of the traumatic event or loss of awareness of situations. Management. Selective serotonin reuptake inhibitors are efficacious in reducing PTSD symptoms. Examples include paroxetine can be started at 20 milligrams per day orally up to 60 milligrams per day, or citrulline can be started at 25 or 50 milligrams per day orally up to 250 milligrams per day. Thank you.